İlk önce ben iki teşekkür yapmak istiyorum.
First of all, I would like to thank two people. First of all, I would like to thank you for being here at this time of the day. And secondly, I would like to thank Hülya Turgut for being with us in such a challenging situation. I would like to extend my condolences to her. And I lost my father as well, and I'm missing him very much too. First of all, I'm explaining you why I'm making this presentation, because at the beginning we started this as a social responsibility project, because care facilities are becoming more important in Turkey, because as people in the field we know it very well. In the state hospitals there are many people and patients coming from care facilities. Hülya made a very good introduction to the use of antipsychotics, and I was going to make a contribution, but I don't need to talk about that at the moment because she already did. Yes, the use of antipsychotics is increasing day by day, and I will try to show this through data. This is a presentation of psychotic disorder patients in Sivas, and they have come to our clinic, and this study was carried out together with Professor Mustafa Yılmaz, and we are going to publish it very soon. For patients with psychotic disorders, in the guidelines, monotherapy is recommended. However, in practice, monotherapy is not usually observed. The research and studies in this field are insufficient, but still multi-therapy is being preferred more. So Hülya talked about this, and she also talked about the causes. As mentioned by Orhan Bey and Hülya, we have to look for the reasons and the causes in us, in other words, in psychiatrists and clinicians. So why do we have polypharmacy in place? Hülya gave an example from Florida. In all the treatment guidelines, including Turkish Psychiatry Association's guideline, the first recommended treatment modality is monotherapy. Polytherapy or polypharmacy is needed when the antipsychotic is going to change. And at the third stage, clozapine is tried out, as Hülya mentioned, and later on, if needed, polypharmacy or polytherapy should be used. So at the very outset of this study, we thought that, yes, polypharmacy can be administered. However, what is the effect of it on the economy? Is it really necessary? So at the beginning, could we calculate the treatment cost? But later on, we wanted to identify the data, and at the second stage, we wanted to calculate the cost. I would like to tell you which drugs were used and in which amounts they were used. And through slides I will try to explain to you. Polypharmacy ranges between 5% to 70% in the rest of the world. And I have never seen a study in the care facilities from this perspective. And this is the first study in the care facilities. As you know, care facilities take care of patients which have chronic diseases and which need care. And roughly speaking, 70 or 60% of the patients staying in these facilities are patients of mental health, and they also there are some patients with Alzheimer's disease and dementia, and there are very few patients with physical disabilities, but majority of them are patients of mental health and mental disorders. And amongst the mental disorders, schizophrenia and other psychotic disorders are seen at the most. And these care facilities are working like a mental health hospital. This is the reality in Turkey. Maybe the logic is right, but I don't think that all of the practices are right there. And you can just follow this from the media, from the newspapers, and from TVs as well. Let's pass on to data. Here, socio-demographic features and characteristics and poly-use and mono-use are compared. We tried to differentiate in between them, and we wanted to provide statistically important differences. And 200 patients were involved, and according to the DSM-4 criteria, people with psychotic disorders and using antipsychotic drugs more than a month ago. Amongst these 200 patients, 129 of them are male, it's 64.5%, and the age, the median age is 43.8%, and the youngest is 16 years old, and the oldest is 81 years old. In terms of their education, 6.2 is in terms of years, and their average education is 6.2 years, or it's just primary school. In terms of marital status, 20 of them were married, and it corresponded to 10%. In terms of occupation, 86% were jobless, or persons who did not work before. In terms of family support, they said that 123 people had family support. Please do not understand it as being with them. They called them once in a while. However, 67 patients did not have any family member calling them or visiting them. 165 patients did not have physical disease, and physical violence was exerted by 75 patients, corresponding to 37%, and suicide attempt was done by 40 patients, and it corresponds to 20%. Number of hospitalization, 150 patients responded to that. It is very difficult and challenging to access certain data. The patient did not know, and we could not access their families, and the people at the care facility did not know it very well. And the median number is 4.2, and it ranges between 0 to 15 admissions. And mental disease, schizophrenia, is 80%, and we divided them into two as psychotic diseases and unspecified or not otherwise defined disease group was the other group. And CAD was schizophrenia and schizoaffective disorder. I think from the significance point of view, age is very important. Those who are young, and those who have suicidal attempts, and those who have more hospitalization rates, and when their COIS rate is high, and with those with schizoaffective disorder. Polypharmacy was statistically significant. Let's start with monotherapies, if you like. This is the antipsychotic drug used as a monotherapy. In total, 76 patients used monotherapy. And you can see olanzapine, quetiapine, and risperidone, and clozapine, haloperidol, aripiprazole, and all of them are listed here in this table. And when we divide 200 into 2, 76% corresponds to 38%. In other words, in the rate of 72% or 62%, polypharmacy is under the question for antipsychotic drug use. When we talk about polypharmacy, what do we mean? We mean 2 or more psychotic drug use. Piperidine, for example, is added. Chlorpromazine is added. Chlorpromazine dosage is 200 milligrams. 100 milligram is not given for hypnotic purposes, but for treatment purposes. Mood stabilizers are also seen here. You can also see the disorders. So in the rate of 38%, monotherapy was under the question for this group of patients. So dual antipsychotic drugs use, this corresponds to 68 patients, and olanzapine and quetiapine are used together. It is followed by zuglutin and olanzapine halidopan and olanzapine risperidol and olanzapine clozapine. And then I will be giving this to you as a compilation, and this was the dual antipsychotic drug use, and it corresponds to 34% in total of 68 patients. And triplet antipsychotic drug use, and this is the rate. The total number is 42 patients. 42 patients, in other words, were using 3 antipsychotic drugs at the same time, and this corresponds to 21%. In other words, 21% out of 100 patients, or 32 patients out of 200 patients used 3 antipsychotic drugs. And in the first rank, we see olanzapine and haloperidol and zuglupentixol depot. So we can see that piperidine has been added to the treatment regimen for each and every patient. What about quadruplets or 4 or 5 antipsychotic drug combinations? So for usage of 4 or 5 antipsychotic drug combinations, the number is 14, and 10 patients were using 4 drugs, and it corresponds to 5%. And olanzapine, quetiapine, haloperidol, zuglupentixol depot is the most common one, and there were some patients who were using 5 antipsychotic drugs. Yes, 4 patients were using 5 antipsychotics, and it corresponds to 2%. And what were they? Olanzapine, quetiapine, zuglupentixol depot, haloperidol, and they're not the same actually. They are different drugs, and different drugs were used. And the treatment algorithms, and Mustafa Bey is getting angry with that. These are not recommended by the Psychiatry Association either. So in this slide, we make a general assessment. As you can see, a single antipsychotropic use is 76, and 6 of them are using mood stabilizers, 21 of them are using piperidine, and 7 chlorpromazine, and 50 schizophrenia and schizoactive disorders. And in the triplet usage, 31 are using piperidine, and 9 are using chlorpromazine, and 6 of them are using mood stabilizers. And for the 4 or 5 antipsychotics, 14 are using piperidine, 1 is using chlorpromazine, and 1 is using mood stabilizers. And when we look at it from a perspective of 200 patients, 121 of them are using piperidine, and in other words, 62% uses polypharmacy and 38% uses monotherapy. I think this is the reality in Turkey, and I'm going to be like that in many provinces in Turkey. I wonder if you're helping the patient with this, or are we causing different problems? I think we should be reviewing and revisiting these problems over and over again. Thank you very much for your attention.